So we're just concluding the year of the digital profession, and I'd like to take this opportunity to highlight a few of the successes that we've had over the last 12 months. The first, I would say, is in the area of engagement. We have successfully managed to put this on the agenda. For the first time, we're now able to facilitate discussions across the regions. In fact, we're doing that now. We're hosting 16 workshops across the regions to talk about this topic. The second area of success, I would say, is recognition. We had the privilege of recognising a diverse group of 8 colleagues working across both the health and care sector in digital data and technology roles. What it gave us was not only an insight into the type of work they do, but also the difference that they're making to the delivery of patient care. And then the third area is to do with insight and evidence gathering. So the second half of last year, we published a call for evidence to gather real hard first-hand evidence about what the challenges were that were being faced on the ground when it came to attracting, recruiting and retaining staff in digital data and technology and informatics roles. We also wanted to use that opportunity to get a clearer sense of what their demand was. And in fact, all of those insights now we get to sort of contribute towards the work that we're doing around developing the National Digital Workforce Plan, which will set out a set of prioritised actions that as a system we will commit to delivering over the next 10 years that will really start to help us narrow the skills gap. And that will look at a number of different areas like capacity building through creating more supply, through graduate schemes, apprenticeship schemes. We also need to implement initiatives that are going to help with staff retention. And so one of the things that we need to work with the system to do is to build the case for why people should come and work with us and stay with us. And the third big area is around professionalisation. And what I mean by this is that we're not saying is that people in these roles are not professional. Of course they are, but we are finding a huge diversity of how the profession is defined across the sector, how roles are defined, how they are banded, and therefore how they are paid. And we need to try and bring consistency across that piece so that for an individual that has decided to take on a career in this sector, they have more confidence that, number one, there's a career pathway, but also it starts to reduce what we call internal competition between provider organisations. If we're able to actually deliver the digital transformation ambitions, we're more likely to achieve the transformations in service delivery, which has positive impact on patient care, patient experience, but also staff experience as well. We really need to invest in the people to make sure that we can deliver.